Ladies and gentlemen, the National Spasmodic Torticollis Association presents Home Exercises for Spasmodic Torticollis Therapy. Here to introduce our videotape is Dr. Paul Cullis, Clinical Associate Professor of Neurology at Wayne State University School of Medicine in Detroit, Michigan.
Hello. I have been the chairman of the Medical Advisory Board of the National Spasmodic Torticollis Association since its inception in 1981. Over that short period of time, great changes have occurred in the treatment of spasmodic torticollis, a neurological disorder that affects the muscles of the neck, causing the head to pull, turn, or jerk towards the shoulder. But if you're viewing this videotape, we will assume you are a victim of spasmodic torticollis, have been so diagnosed, and are familiar with your symptoms and limitations. Physical therapy is important in your life as an S-tier, but should be directed and monitored by your personal physician and qualified therapists. Included in this videotape and its companion booklet are exercises which, when properly performed, can help your flexibility and improve your endurance and strength. The two therapists we have selected to demonstrate these exercises have each worked with many S-tiers. We believe their experience can indeed be of benefit to you. Our first presenter is Kathryn Brewer of Phoenix, Arizona. Kathy has been associated with the Arizona Dystonia Institute since 1987 and serves many S-tiers at the Western Rehab services in that city.
Living with spasmodic torticollis often means a constant struggle to perform routine activities of daily living, occupational tasks, leisure, and recreational activities. But doing is everything. Don't give up. The key to coping with ST or with any chronic condition is to maintain function. And exercise, both for general health and specific to ST, is the ingredient to assuring optimal activity. The general benefits of exercise are the same for all of us, regardless of our individual condition. The gains are universal, and I'd like to review them with you. But first, the myth. Most people think that in order for exercise to be beneficial, it has to hurt, be boring, or no fun at all, and take a lot of time, and most of all, you have to sweat. None of those things are true. Furthermore, many S-tiers avoid exercise because of fear of worsening their condition. By experience, you may have found that certain postures or activities do activate spasm or pain. As a physical therapist, however, I must say, never give up moving. Maintaining physical activity is to your advantage. That's the purpose of this tape, to provide you with a home exercise guide. It does not replace medical management by a physician or an assessment and hands-on treatment by a physical therapist. Let me describe for you some of the benefits of a regular, non-strenuous exercise program. There are three components to fitness: strength, flexibility, and endurance, or aerobic capacity. S-tiers may participate in all of these safely with a few additional guidelines. Strengthening exercise helps to build good muscle tone and body composition, or the ratio of lean body mass to fat. Performing low resistance but high repetition exercise with equipment or free weights will improve tone without bulk. Stretching exercise, most commonly used as warm-up and cool-down routines, promote flexibility and limberness and are particularly important in preventing orthopedic injury during strenuous or competitive activities. Aerobic exercises are those rhythmic, repetitive movement, continuous activities which benefit us in the all-important cardiovascular function and reduction of heart disease risk factors. Examples are walking, cycling, rowing, swimming, cross-country skiing, running or jogging, and even others. Aerobic exercise makes our heart and lungs stronger, more efficient, and gives us greater endurance for prolonged activities. The aerobically fit individual will have lower blood pressure and cholesterol levels, experience greater energy, decreased effects of stress, and enhanced weight loss or weight maintenance due to the increased caloric expenditure. The guidelines for maintaining aerobic capacity are to perform the activity for a duration of at least 20 minutes, at a moderate intensity. For example, you should still be able to carry on a conversation, and at a frequency of 3 to 4 times per week. A longer duration and or a higher frequency will enhance the training effect toward gains in fitness level. If you have been out of shape or inactive, consult with your physician before beginning an aerobic fitness program so that risk factors may be identified and monitored and specific heart rate guidelines may be prescribed. Additionally, one of the most profound effects of activity and exercise is on the aging process. Getting older is something we would all like to avoid. A sedentary lifestyle enhances the physiological deterioration processes that are recognized as aging. Keeping active is the key to promoting wellness and minimizing the effects of inactivity, which become more common with increasing age. So the message about exercise for STers is that it's okay to participate in a regular fitness program for general health and well-being. The home exercise guide we will demonstrate for you now is designed to focus on the specific needs of ST. The insidious muscle spasms of ST create abnormal patterns of movement and postures, which may in turn accelerate degenerative changes in the spinal joints, create muscle balance in the neck and shoulder girdle, and cause muscle and joint pain. All of this contributes to dysfunction. The goals of these exercises are as follows. Number 1, maintain available range of motion of the spine and shoulder girdle for functional activities. Number 2, prevention of secondary musculoskeletal problems, for example, osteoporosis, muscle atrophy, joint shortening and contractures. Number 3, minimize degenerative changes of the joint and surrounding tissues common to degenerative arthritis, which is a very painful condition. Number 4, decrease pain from muscle tension by increasing blood flow and normal muscle contractions. And finally, number 5, improve overall muscle balance and posture, which, if unattended, may contribute to curvatures of the spine, headache syndromes, low back, and pelvic problems. There are some precautions and guidelines for these exercises as well, which may help you succeed in achieving the greatest benefit. 1, start slowly, progress gradually. Don't expect to accomplish everything the first day. Number 2, if it hurts, don't do it. If your symptoms vary, there may be certain times when an exercise aggravates pain or spasm. If that's the case, hold off. Also recognize that there's a great deal of variance in how ST presents. Not all exercises are tolerated well by all STers. Pick and choose the exercises that seem to help you the most. 3, stabilize proper postures when performing exercises. We will point these out as we go. Number 4, be consistent with your program. Perform it regularly. You will experience greater benefit. And 5, choose a time and place for your exercise that is convenient for your schedule. You will be more successful if you make it easy to comply. Each of you probably has certain positions in which your ST is worse or aggravated, restricting freedom of motion, and likewise a position in which it is better. In range of motion exercise, the goal is not only quantity of motion, but quality. Choose a position in which there is the least resistance to movement. This may be sitting, lying down, or even dangling. There are 4 planes of motion to the neck: forward and backward, side to side, rotation, and a combination of those in a diagonal plane. Practice all of these motions slowly to the maximum available range. The first motion we're going to go through in range of motion is rotation side to side. Take your chin, take it closest to your left shoulder, so you're going to turn to the left. Be careful to not let your shoulders rotate, and just go side to side 2 or 3 times with slow motions. Good. Okay. The next motion we'll do is side bending, taking the ear down to the shoulder. And if you're in the dangling position, it'll be probably easier from one side than the other. And now switch and go to the right. Good. And back to the left. And again 2 or 3 times. Fine. Now, the third set of motions is forward and backward. Drop your chin down toward your chest. Let it hang there heavy so you feel the stretch down the back of the neck, and then come back up to neutral. We're not really going to go into a hyperextension or looking up, but just to neutral. Down again, chin down toward your breastbone, and come back up, and again down, and let it stretch. These movements need to be done very slowly so that you have good quality of motion. And up. And the final direction is in a diagonal, as if you were going to look down toward your knee or your foot. So a combination pattern of a little bit to the side and forward. You should feel that stretch in a different angle on the side of your neck toward the back, and up and over to the other side, looking down to the knee, and up. Once again to the left. Good. And up. And stretch. Fine. Okay. Each of those should be done 4 to 5 times, and again, very slowly. The chin tuck is an exercise which helps straighten the cervical spine. It elongates, makes it more vertical and upright. And for STers, the advantage of this exercise is that it helps you move into a neutral or a midline posture, and you'll hear more about that. The maneuver is to tuck your chin as if you wanted to touch your chin to your Adam's apple, forcing it back, making a double chin, and straightening the cervical spine. And as you can see it from the side, the ear lines up over the shoulder. You want to hold it and then relax, and then do it again. Pull back as long and tall as possible. Make sure your trunk is nice and straight, and then relax. From the front view, it'll look like your head is neutral over your shoulders. It's symmetrical as you pull back and straighten the spine. And hold and relax. In between times, your head may turn. That's okay. Again, chin tuck and hold and relax. These next few exercises are focused on the muscles of the upper back and shoulder blade areas. Toning these muscles will improve posture and increase tolerance for upper extremity work. First, you lie on your stomach. You may need a pillow under your hips to decrease the stress on your low back. Rest your head in the most comfortable position. A small towel roll may be helpful for that. Now, place your hands up on the back. Keep them together. From this position, I want you to lift your arms up and hold and relax and place them down. Keep going with this. You can start off with 3 or 4 repetitions and increase to 10 as it becomes easy for you. Lift and down. This works the top part of the shoulder blade area. One more time. Lift and down. Good. Now bring your hands around. Place them in the back of your neck. And on this exercise, we're just going to lift the elbows off the table. I don't want your head and shoulders coming up. We're squeezing the shoulder blades together. Again, start off with just 3 or 4. If it's difficult, it'll take longer to build up to 10 repetitions. You should feel this right between the shoulder blades. Fine. Now, the next position, your hands are out in front of you. We're going to start with just lifting one arm at a time. Lift it up off the table, and you'll feel this down below your shoulder blades in the mid-back region. And relax. Switch to the other side and lift. And relax. If that is easy, one arm at a time, you may progress to lifting both arms together, which is your goal. And left. Good. Now we'll try it with both arms together. Lift. This is hard for a lot of people. Most of us are very tight in the upper back region and the shoulder region. So don't let it frustrate you. Just do the best you can. Okay. Rest a moment. Now, the last one is a combination of the single arm lift and the opposite leg. What this does is it works the paraspinal muscles, the muscles that follow all the way down the length of the spine, all the way to the sacrum. So you're going to feel a full spinal movement here. We're going to lift the right arm and the left leg together, almost like a swimming stroke, and down. And switch to the opposite side, and down. What's happening when you do this, you may keep going, is that we are aligning that spine as straight as possible and working those postural muscles which give you the support for neutral posture. Fine. Good. There are some stretches that are particularly good for the upper back and neck area. This is a difficult area to stretch, and if you'll try these positions, I think you'll find them helpful. The first one is called a yoga cat. Some of you may have done it in other types of exercise programs. You need to get on your hands and knees. Let your hips sit back on your heels and stretch forward slowly, keeping your bottom back on your heels and elongating through your spine as much as possible. Let your head even drop forward. You'll feel the stretch along the sides, under the arms, and the mid-back region. You want to just get into this position and hold. It's not something you repeat over and over, but stretch, feel the muscles, let go, and then try to stretch out even further. Holding for 30 to 45 seconds just one time is probably good. Okay, come back out of that position. The next one is from a long sit position. Your feet will be out in front of you. It's a spinal twist. We want to cross one leg over the other, bend that knee up a little bit. Your torso is going to turn in the opposite direction. You use your arm against your knee to give you some leverage. Turn your head to the left. This hand can reach down and lever your shoulders against your hips to get as much rotation in opposite directions through your spine. It may be hard for you to turn your head depending on which way your movement disorder goes, but do your best. And again, hold for 30 to 45 seconds. As you feel things stretch and relax, stretch further and get as much range as you can. Good. Now to do that on the opposite side, just unfold yourself. The other leg crosses over. Your shoulders this time come to the right. Your head, your chin follows your shoulder. Work your shoulders against your pelvis and get a good long stretch and hold. This can also be done from sitting in an office chair or the kitchen chair with your legs down, but you can still get that kind of stretch, shoulders against the knees, and stretch out as you need to just change your position. Okay, and relax. We will be demonstrating for you 7 different exercises with the TheraBand. Each one of them should be done several times each. Start with only 2 or 3 repetitions until you build up the strength to tolerate more. They should be done slowly, and your goal is to get to 10 or 12 of each one. The TheraBand or the elastic cord that you're using, you should start out with a lot of length to give yourself very little resistance. Then as you get stronger, the exercises become easier. You progress your resistance by shortening the band, giving you more pull and more work. We don't want you struggling with these. Keep them at a good, comfortable length in your band so you get good work, but not pain with your motions. Number 1 is a diagonal stretch with the TheraBand in front of you. Start with your hands down together, and you're going to stretch the band so that it makes half of an X across your body. Hold it, and then slowly recoil the band. Don't let it snap back. Do a couple of those. Good. And now we'll switch and put the other hand on top. So we finish our X. We've done a diagonal to both sides. And stretch again and hold and slowly return. The second is an overhead stretch. Both arms start on top, and you're going to pull the arms down to the side until you're at a horizontal level. Good, with the TheraBand behind your head. And up, and again, pull down, and hold, and up. Fine. The third exercise starts from behind the head. Your hands are on your shoulders, the band behind your head. Now, stretch the arms out to the side. The final position is the same as the other, but we're using different muscles to get there. Bend from the elbows, release, good, and pull again, hold, and slowly release. Fine. Bring the band in front of you again, hold it chest high, and now you're going to pull directly open with your shoulders level. And release, and pull open, and release. Okay. A couple from behind. You're going to, you turn around so we can see the back side. Your hands down by your hips, and now you're just going to spread your arms side to side, lifting the band about waist level, perfect. Hold and release back down to the starting position, and again open to horizontal level, hold and release. Then we do a vertical dimension also from behind. One hand is behind your head, the other behind your hips, like a towel drying your back after a shower. You're going to pull both arms stretched, pull the band and hold and release. And again, stretch open and release. And again, with this one, we need to switch sides. Put the other hand on top and open and release. And the last time, pull both arms straight and release. Fine. Now, Howard, if you'll turn around again. And the last exercise is a little tricky. Stand, let the TheraBand drop down and put your feet on both ends. You're holding it in the middle. Nope. You're holding it, that's it. Pick it up in the middle. Howard, you're right. Now, don't move your feet or you'll get snapped. Give yourself a little more slack, Dick. Hold on the very tips. That's it. Now, go ahead and stand up and let your arms stay straight. Now, from that position, keep your weight forward on your toes. Just bring your hands up this way with your elbows out to the side, and you're working the tops of the shoulders to do that. Good, and release. And bring it up. We don't want trunk motion. You're both doing a good job of keeping your back straight. Lift and release. Good. Tension breakers are a group of maneuvers that can be used just to release the tension that builds up, perhaps from a static sitting posture of desk work or a heavy task such as carrying groceries or vacuuming. What you want to do is find which one of these works for you the best and use it when you feel that tension becoming uncomfortable. One of them we've already done, and that's the chin tuck. So again, if to review it, square off from the shoulders, pull the chin back to elongate and straighten the neck. And release. Usually 3 or 4 of these is enough just to kind of get rid of the buildup of spasm and tension. And if you'll do that one again, pull back, chin, and relax. The second one is simply shoulder circles, moving the shoulders through a large range of motion and working the shoulder blades across the back, stretching out the muscles. Often will just relieve the tension that you're feeling. Good. The third one, place your hands behind your head and stretch your elbows back so that you get a good stretch across the chest. Your shoulder blades squeeze together. Take a nice deep breath, stretch, and relax. And again, pull back, deep breath, stretch, and relax. The final tension breaker is called a corner push-up. Face a corner, square yourself off, and place your hands shoulder height against the wall. With your feet together, keep your heels on the floor and lean into the corner. And do a push-up just as you would on the floor. What you'll feel is a stretch across the front of your chest. You'll feel your shoulder blades come together. And as you repeat it and work these muscles, you'll find that it helps relieve, again, that tension that builds up across the shoulders. Choose an activity which does not increase your spasm or pain. If walking makes your head pull more, try swimming or a stationary bike. Pool exercises that don't require performing strokes are just fine. The water provides a buoyant effect which often decreases the muscle spasms in your neck. Choosing 2 or 3 different tolerable activities is also okay and can keep you from getting bored with your program. Remember the guidelines: continuous for 20 minutes, moderate intensity only, and 3 to 4 times per week.
Our second presenter is Kim Wanegar, Director of Physical Therapy Services at Windham Hospital's satellite facility in Windham, Connecticut.
The principles Kathy has just presented apply to this phase of your home exercise guide as well. The purpose of this phase is to blend the individual components of exercise and movement into daily function. Before we get involved with the specific activities, I'd like to describe the basic building blocks of movement. The first building block is how our body reacts to outside influences. Gravity is an invisible force which our body reacts to. This is why you may find you have better head control while you're in the water, inverted, as Kathy had shown in her earlier segment, or just when you're lying down. In these positions, the effects of gravity are reduced. Once we sit up or stand, these forces present a resistance we must move against. The second building block of movement is head control. Our heads predict movement. Our body will follow or balance in reaction to the head position. A demonstration of that will be, we'll have Debbie go from sit to stand, and we'll adjust her head position and observe what her body does in reaction to that head position. Debbie, I'm going to have you stand up, keeping your head forward. Okay, as you stand, you'll see that her head maintains forward and her whole body is slightly flexed forward or bent forward. Okay, Debbie, I'm going to have you sit back down. This time we're going to have her stand, letting her eyes and her head control the movement. As she stands, she's going to lift her head upward, and I want you to observe her posture once she's reached the standing position. Her body is followed nicely. It's balanced out. Her head's in the center, and now she's ready for movement. Okay, have you sit back down. Another example of how our head reacts to our body's movement is I want you to imagine you're in your car and you're taking a very sharp right-hand corner. Now observe what Debbie's body does. Her hips respond by going to the left, and watch what her head does. Her head comes back to the center to balance her so that she doesn't fall over to the side. Also helps to orient her to space so that she can plan what to do as she goes around that corner. Therefore, we will begin our activities on the floor, reducing the effects of gravity, then we will progress upward. The purpose of the following exercises and activities is to assist in the reestablishment of the responses which allow for improved head control. We will now present a two-phased program. The first phase involves activities which are performed in a more stationary posture. Then we gradually introduce movement while maintaining our head in center or midline. It's very important to start these activities gradually. You want to begin with just 2 or 3 repetitions. As you gain control and comfort with them, you can increase to a goal of 10 repetitions. But please don't exceed 10 repetitions. 10 is really all you need. Another important component of this is to always stop movement at a point which you lose control, lose that midline control. This does not mean to stop the entire exercise. It just means to limit your movement to your range of control. Now we'll get into the exercise program. The first position for exercise will be on the floor, on your stomach. We're going to take a towel roll, and you'll have to adjust this to your level of comfort. This is going to be placed under your forehead, on the floor, so that your head is relaxed and as much in the center as possible. You feel comfortable? Mm-hmm. Okay, good. The first exercise you're going to do is a warm-up exercise. You're going to bring your right arm out in front of you. You're going to lift it up and then down. We're going to do these exercises alternating right and left. Can you bring your left arm out, please? Okay, and left. Okay, bring it right more to the front of you. There you go. And right, lift. Good. And left. And right. And left. Very good. The next exercise we describe as the frog reach. And why we call it that is, you'll see in a minute. We're going to bring your left arm back down here by your side. Your right arm is out in front of you. You bring your left knee, roll it out to the side. Bring your knee up toward your chest as far as you can. And you want to maintain that stretch for about 10 seconds. Then together you will bring them back down to their original position. Okay, now we do the same thing. On the opposite side, we reach out with our arm. We bring our opposite leg out to the side. Bring it up as far as we can. We maintain that stretch for 10 seconds. If at any point you feel that your head is starting to turn or start to fight the movement, you want to stop, back up a little bit till you reach a point where your head is in a comfortable, relaxed position, and down. It's very important that you alternate right and left, and that you move your arms alternately. Good. And down. Nice. Good. And relax. The next activity we're going to demonstrate, you'll move from being flat on your stomach to up on your elbows. So we'll remove the towel, and you'll place your elbows directly under your shoulders. From this position, you're going to move your head down forward, chin toward your chest, return it back to where it's centered, and down again. And again, remember, please just start with 2 or 3 repetitions. Good. And down one more. Good. Good. Now we're going to incorporate 2 movements together. We'll bring our head forward, but we'll also include rotation. So she'll bring her head forward toward her opposite shoulder, toward the left. Good. And back to center. And turn and bend toward the right. And return to center. And can you repeat that a couple times? Thanks. And return to center. Beautiful. If you find that while doing these activities that your neck tone is increasing, your head starts to pull in one direction or another, take a minute and recruit some assistance, and I'll show you a technique you can use to get better head control. All you need for assistance is someone who can sit to the side of you and from behind and apply with their 2 hands some very gentle pressure to the top of your head. You're going to be the one who dictates that the pressure should be toward the front of the head, the middle of the head, or the back of the head. This pressure should not be forceful. It should not be compressive downward into the spine. It should be just enough pressure to give her some sensory input and to give increased control. I'd like you to do the same thing again with the pressure. And forward. And up. Now, I am not controlling or creating the movement. She is doing all of that herself. All I'm doing is giving her some sensory input into the top of her head. Good. Okay, now you're going to go forward and to the left. So I'm following with her. I am not controlling the movement at all, and that's very, very important. Nice. Good. And always return to center. And relax. Thanks. Okay. The next position for the next activity involves getting up on your hands and knees, or all 4s. So you're going to come right up on your hands and knees. Okay. Again, you want to make sure your back is nice and level, that your hands are under your shoulders. Okay. Your knees are slightly apart, about 3 or 4 inches, and that the knees are in line with the hip. Okay? Again, the most important part of this is to try to maintain your head in center. The first exercise you're going to do in this position is reaching forward with your right arm. Good. And down. And reaching forward with your left. I'd like you to try to keep your chin down so that you feel like you have a straight line all the way along your spine. There you go. Okay, and try again. Reach forward. Good. Now we're just going to let our arms relax and hold us up. We're going to bring our hips and knees into this now. We're going to bring our right knee toward our chest, forward as far as we can, without losing head control, and then back. And return it to a position directly under our hip, and then our left knee will come forward as far as we can without losing head control. Good. And return it to a position directly under the hip. And then we'll repeat with the right. And the left. And at any time you lose head control, reduce the amount of movement you're producing with your legs. Keep your head in center and try to keep your head as relaxed as possible. Good. The position for the next exercise involves getting up on your hands and knees, or it's called all fours. Okay? How you position yourself is very important for this exercise. You make sure, again, that your hands are directly under your shoulders, your knees are 3 to 4 inches apart, and your knees are directly under your hips. You want your back to be as straight as possible, and there to be as much of a straight line along your spine to the back of your head as possible, so your head is not tilted backward, is not tilted forward. It's in what we call neutral or midline. Okay? If at any point you lose head control or any movement control during this exercise, you're to stop and only pursue with the components that you have control with. Okay, the first part of the exercise is you're going to reach forward with your right arm and hold down. Nice. And repeat with the left. You are always going to alternate right and left. And repeat. Good. And left. Good. And come back down. Okay. Find your point of balance and stabilization. And now you're going to bring I'm going to start with your left knee forward, and then kick it out behind you. Good. And down. Right knee forward, kick it out behind you, and down. Now you can see where he lost a little bit of control there. He was using a lot of motion. He was trying to bring his leg as far forward as he could and as far back as he could. That's not the purpose of the exercise. The purpose of the exercise is to move within where your control is. So I'm going to ask him to slow the exercise down and to only work to the point at which he maintains control. Can we try that again? Much better. Excellent. And right forward and back. And you can see the difference. His body was not swaying. He had much better control of the movement. Can you repeat that a couple times, please? Good. Nice. Now we'll return to the all-fours position, remembering our hands under our shoulders, our knees under our hips. Now we're going to be using the body alternately from shoulder to leg. You're going to bring your right arm forward in front of you, and you're going to kick out your left leg behind you and hold that position. You should hold that position anywhere from 2 seconds to 10 seconds. Totally base that time on your ability to control it. If you lose control, then you've held it a little bit too long. And come on down. Good. And left arm and right leg. You may find that you have better control when you raise your right arm and left leg than you do when you raise your left arm and right leg. You need to pay close attention to how your body responds, and you respond and work within those limits. Good. Very good. Okay. We're now going to move our way into phase 2 of this program. Phase 2 starts to introduce more rotation of the body, more movement of our body in space. We are now going to introduce some simple movement to the phase 1 program. How you want to position yourself is you want to have a couple pillows available so that your head is positioned in midline, but it's relaxed. During this exercise, we want the head to stay relaxed because the portion of your body that's going to move is your shoulders and your hips. Okay. Once you've achieved that position and you know that your head is relaxed, we're going to introduce some rotation between the shoulders and the hips. And how we do that is going to reach forward with the top arm. And as the top arm comes forward, the top hip is going to come backwards. As you reach forward, allow your arm to relax. As your leg comes backward, allow that leg to drop down and relax. You want to hold that position for 5 to 10 seconds and just let your body enjoy the stretch. Now you're going to move the opposite direction. As the shoulder comes backward, the hip comes forward. Again, allow your arm and your hip to relax and maintain that stretch for 5 to 10 seconds. Reach forward as the hip comes back. Let the leg relax, the arm relax. Good. Make sure your head is in a comfortable position. Nice. And bring the shoulder back and the hip forward. You'll do this 2 to 3 repetitions until you get comfortable. You can work toward the maximum of 10 repetitions. Once you've completed this exercise on your right side, you're going to turn over and repeat the same exercise on your left. Good. The next exercise in the movement phase is you're going to roll over onto your back. Okay. Make sure that your body is not crooked, that it's as straight as it can be. So you're going to bring your shoulders. Okay. What you might want to do is find a point on your ceiling that you can orient yourself to. Okay. You're going to bend up both knees. Okay. And you shift your hips a little bit to your right. Good. Make sure your feet are firmly planted on the floor. Your knees are about, an inch, inch and a half apart. Okay? Now what you're going to do without moving your upper body, let your head relax, your upper body relax. You're going to allow the knees to go to the left. And then you're going to allow them to move to the right. If at any point during this movement you notice that your neck is turning or pulling, back off a little bit. Just make those legs move in a range of motion that is comfortable and does not increase your neck or muscle activity. Good. The objectives of the Phase 2 component are to achieve increased control and decreased symptoms in more dynamic movement. You want to keep in mind with these Phase 2 exercises and activities that you want to start slowly, just as in Phase 1. Start doing them 2 or 3 repetitions, increase gradually to a maximum of 10. The first activity in Phase 2 is rolling. How we roll is very important. I'm going to give you a demonstration of log rolling. Okay, I want you to roll like you did when you first showed me, holding your body tight. As you can observe, his body is moving as a unit. And stop right there and come on back. He's rolling just like you would see a tree log roll down a hill. There's no change or adjustment in the body to space. He's just moving as a unit. What we want to see, to reflect back to midlining and adjustment in our body to space, we want to see our head and shoulders and hips respond alternately to have better control of that movement. Okay, so what we want to see him do is we want to see him lead with his head and his shoulders, and you're going to reach forward. The knee is bent, and we roll. Good. And we reach back and roll forward. Nice, and stop. Good. And come back the other direction. Good. And relax. This rolling in one direction, then the other would constitute 1 repetition. Okay. Would you repeat that, please? And reach. Good. A little more relaxation in the arms. Good. And reach, and then come on back. And that would be 2. This, again, start with 2 or 3 repetitions and increase slowly. The next position of the second exercise of Phase 2 is to get up on all fours on your hands and knees. I think you're going to face. Yep, that looks good. I think we'll face this way. Okay. Again, you want to remember that you're in good alignment. Your shoulders and your hands are directly in line. Your knee is directly in line with your hip. Your back is relatively straight, and your head is centered. It's not tipped back, and it's not brought way forward. It's as midline as possible. We did this in Phase 1, but we didn't actually move our body. We just moved our body parts. This time we're going to actually move our body. You're going to notice that when he crawls forward, he's going to move opposite arm and leg, and that's very important in balancing our spine. You're going to advance. You're going to bring your left arm forward and your right knee forward. Good. And alternate. And you're going to also go backwards because you're using different muscle groups. Good. And come forward. Alternating right and left with each step. Beautiful. And come on back. Good. Okay, from this position, you're going to progress to up on your knees. So have you come up on your knees? Okay. Have you turn and face the camera? Good. Okay. And then you're not going to sit on your heels. You're going to have, again, your knees are going to be directly under your hips. Your shoulders are going to be directly over your hips. And your head is going to be in the center. We're not going to impose any movement here because right now what we're introducing is that gravity force we talked about earlier in the program. And you can see his head is responding to gravity where you did not see it in the lower positions where he was not confronting the full impact of gravity. He's getting just a little bit of fluctuation of the head and neck from side to side. If you don't feel like you have good head control in this position, there are a couple things you can do. First, look at your position. Are his knees apart? Okay, we can actually bring his knees apart a little bit more. About 4 to 6 inches looks good. Okay. Are his shoulders directly over his hips? Okay. That looks pretty good. Okay. And that improved his head position and reduced that fluctuation in his head position. The other thing you can do, which we did in one of the phase 1 exercises, is to get an assistant or recruit someone to help you for a minute and apply that gentle pressure to the top of the head. Okay? And all this does is it provides some orientation, some sensory input as to where is center. The pressure I'm applying is very gentle. I could have an egg under my hands and not break it, but it gives him a sense of where his head is in space. Okay? And you can just hold that for about 30 seconds. Okay? Try not to let your hips move. Just try to hold that position. Good. Good. Now the next movement he'll go into from on his knees is what we call half kneeling. You'll bring your right leg forward, position your right foot in front of you, and hold that. And the same thing, you want to look at how his shoulders are in relation to his hips and what his head is doing in space. And he's got pretty good control here. If you find that you're losing some head control, again, go back to having someone help assist you into that midline position, and then apply some very gentle pressure downward to maintain that midline position. Okay, good. Bring your leg down, and you're going to alternate right and left. And this concludes the Phase 2 activities. Thank you very much.
And now we thank our volunteer models, Richard Gennermann, Sue Locks, Debra Poppe, and Howard Thiel. These home exercises for Spasmodic Torticollis Therapy have been brought to you by the National Spasmodic Torticollis Association, whose members wish to remind you that you are not alone. For further information or membership services, write to the NSTA at Post Office Box 476, Elm Grove, Wisconsin 53122, or call toll-free 1-800-HURTFUL. That is 1-800-487-8385. This has been an ASCOM International production.